there are two types of philosophies which is broadly classified. One is taper slip, the other one is composite beam, right?
Yes, sir.
Last class we talked about taper slip and composite beam. Okay. But there are many surgical importance which we are not described or discussed. What are different surgical broaching techniques? What are different cementing techniques? And what is the ideal cement mantle thickness? Okay. Before understanding that why pistoning, why cantilever, why proximal failure will happen, there are four modes. Let us understand these things. Okay. I need participants to be active either by putting up the questions or they can take the mic rights and ask questions. Okay. So what is most important? To understand how each and individual thing contribute to the failure. Okay. Starting from the bone cement. Next is how you prepare your canal, how you cement, what is the stem design, stem material, and reference. We'll broadly divide it into these headings and we'll discuss how each and individual component has an effect towards successful or a failure of a bone cement, right? So we all know that the bone cement has got a viscoelastic property. Okay, this is a viscoelastic property. What does viscoelastic property means? That means it can creep and it can have a stress relaxation. Okay, there are two important properties of a bone cement, that is creep and a stress relaxation. What does creep means? Creep means it's a tendency of a solid material to deform permanently. Okay, it's a tendency of a solid material to deform permanently. When will happen? When a long-term exposure for a stress beyond the yield strength. Yield strength is something which upon the shape will not come back to its original form. Okay, when you read the stress strain theory of Young's curve, you'll understand what the yield point is. We'll keep that aside, but understand this is that property, like any material, it has the yield point. Beyond yield point, whatever it changes permanently. That is called as creep or cold flow. What is stress relaxation? The stress relaxation is it's a decrease in the stress upon constant strain which is generated across a structure. Okay, this is a little very difficult to understand. Just remember there is stress relaxation. Okay, because of this property of stress relaxation, the cement has got its properties. So these are the main primary properties of a cement. Based on this, how a cement can tolerate. What can it can tolerate? When cement is loaded upon, consider this is a bone cement, right? Then the cement is tolerated. Compressive force is given. It can tolerate that compressive force. Okay, because of this stress relaxation. It cannot tolerate shear force. Shear force is what? Something when it is pushing like this, and there is another direction which is pushing in this way. Okay, on the surface. Shear forces are acted on the surface. The most important is it is weakest in tension. That means if this is the cement mantle, okay, and I put pressure here and I put pressure here, the cement, it deforms like this and it breaks in this point. This is the tension. So this tension force, it is weakest. It cannot tolerate. It is all because of the secondary property of the stress relaxation and your yield point. Okay, remember this important point. I'm building the basics from this, how each and everything keeps on adding to it. Next comes what? What we thought initially, what happens even now, they believe, especially in the cemented TKRs, I'm talking about TKRs, the failure mechanism they quote is apart from where is the debonding. Okay, that's a debonding. That was initially thought even for the cemented stems. But now there is something called as a concept of crazing. Okay, there's a concept of crazing. What does crazing means? Crazing is a small crack-like defect which occurs. What does crazing do? Either it is responsible for fracture or it is responsible for fracture propagation of the cement mantle over time. Okay, so crazing is the most important. Crazing is the most important method where a cemented stem will fail with respect to the bone cement. Okay, debonding is the most important method which fails in TKR, whereas in THRs it's the crazing, right? Okay, any doubts till now? We'll start taking the questions. If not, I'll start moving. These are very basic concepts, very theoretical concepts which we should have in the back of our mind while deciding upon doing a cemented THR. Okay, next, the most important property, we always get confused whether to use high viscosity cement or low viscosity cement. समझ में नहीं आ रहा सर, which cement is best?
Vishal sir.
Either yeah.
Sorry to interrupt you, sir. There are a few questions in chat box.
Okay.
Student, they are asking about debonding, sir.
Okay, what is debonding? Debonding concept, see what happens is there is fatigue fracture happening at the, see this is a very important concept for the related TKR. Okay, see this is the cancellous bone. Okay, when you cut the tibia, this is the cancellous bone. When you pressurize the cement will go and accumulate in this crevice, this crevice, this crevice, this crevice, this crevice, and there is your tibial base plate. Right, Dr. Alazar? Yellow color is your bone cement, red color is your cancellous bone, and yellow is your bone cement. What happens is, and when you stem, it has a keel, something, it has got a scale like this. When the weight is transmitted across this bone, the remodeling, okay, remodeling of the bone which is present between the cement and the cancellous bone is affected. That can be because of heat generation by the cement itself or the avascularity. So what happens is this, especially on the medial side, okay, the remodeling process is affected. So what happens over a period of time? This becomes something, instead of like this, it becomes smooth. There's a fatigue failure of this happening. So where do you think the cement is holding now? Okay, there is gradually it is becoming flat or changing its shape, and but the cement has already set. It has not changed. So what happens upon loading? If you continuously load, what happens? This part of the bone becomes weak and there is debonding. Okay, this is one of the reasons they called as a debonding of the bone cement, because of the simple answer is fatigue failure. Fatigue failure of the cancellous trabeculus happening because of avascularity or because of repeated trauma. The bone has to remodel, right? If this is not happening, we end up in failure. Okay. So leave that apart. That is again different part of the story. Okay. Can we go ahead? I hope this is cleared your doubt, Alazar. We'll think about this again. Okay, we'll discuss about the cemented failures again in further future classes in respect to TKR. Okay. So coming about the viscosity. Okay, I was talking about the viscosity, how viscosity has got an effect. Okay, high viscosity or low viscosity, they are most commonly used everywhere. Okay, mostly high viscosity cement is used, but theoretically speaking, low viscosity has got advantage. Okay, how it has got advantage? It has longer curing time. That means you have more time to prepare the canal, put the cement, and put the processes. Okay, this is the reason it has got more theoretical advantage. But most commonly we use high viscosity cement, which has got higher setting time. Okay, but long term results, both high viscosity, low viscosity has good clinical performance. But there are studies, okay, which they say that same cemented stem has been used, same design has been used, and they found out that CMW1 and CMW3, they fail earlier comparing to Pelacos and Simplex. Okay, that means high viscosity cement has got better prognosis than low viscosity cement. Okay, that is one of the studies. But overall, if you see this as CMW1 and CMW3 has got in registry data, according to Norwegian registry data, and I think Austrian registry data. No, not Australian. I think yeah, New Zealand or Australia. I'm not sure. In those the registry data, they have showed that the CMW1 and CMW3 has got high revision failure rates, high revision rates compared to Pelacos and Simplex. Pelacos and Simplex are considered to be low viscosity cements. Okay. So next important thing is coming into the femur preparation. Okay. Femur preparation, there is a lot of many doubts. Sir, whether to remove cancellous bone or not, whether to keep the cancellous bone or not. Okay. And also how the bone cement stability should be there and cement implant stability should be there. Again, it all depends upon what type of principle of philosophy you're planning. Okay. If you're planning a taper slip, that means what should be the most important bonding? The bonding is between the bone and the cement. Okay. Whereas if you're planning a composite beam, then the stability between the cement and the implant has to be strong. Depending upon which stability you want, you have to prepare the canal that way. Okay. And how do you broach the canal? Okay, there are mainly two types. Okay, that's what I'm talking about. The canal is prepared with an aim to provide clean and stable cement interlock between two interfaces, that is bone cement and cement implant. The technique of broaching is mostly depend upon the implant design. Implant design decides what again? Philosophy. It depends either you're going for taper slip or composite beam. Okay. So if you're preparing a taper slip, how your canal should be? We want here bone and cement should be strong. Here cement and stem should be strong. Right? So depending upon, you have to do the broaching. So what are the two techniques they commonly describe? One is standard broaching. What is standard broaching? We overbroach the canal and put a smaller size stem. Why we do it? We need so that the cement mantle of 2 mm or more, depending on the implant design, is the desired outcome. So that is the reason we overbroach it, or we call it as a standard broaching. What is the, theoretically speaking, what happens if more thick is the cement mantle, more stability is the stem, right? It is applicable for what stem? More thick means more stability between the cement and the bone. But what happens is there is increase some subsidence and migration, especially it is associated with the taper polished stem. Okay, even though you increase the cement mantle thickness, but there is increased subsidence and migration with respect to tapered polished stem has been documented. Okay, even though if you put more cement, more thickened cement or less thin cement, the outcome for the polished taper stem is going to be, because polished taper stem has to subside, no? So that is the reason it doesn't matter how much thickness for a polished taper stem is. What it matters is how much well the cement and the bone it has got the hold. Okay. Next important thing is there is something called as what we discuss now is one technique, that is over broaching. Okay, we are broaching one size higher and we are broaching the medium size canal, preparing the canal with a medium size broach and putting a smaller stem broach. There is something called as French paradox. Okay, this is newer concept comparing to the other two concepts. We discussed taper slip, we discussed composite beam. Okay, this concept is called as French paradox. This is different concept. Here, most important technique is in broaching is line to line. What is line to line? If I'm using a medium stem, I'll broach with medium broach. If I'm using a smaller stem, I'll use a smaller broach. So what happens if I do it that way? Consider this is your canal. Okay. And I have broached line to line. And I have put an implant of same size. For this is yellow color is the broaching, and the same way the implant also sits. It is filling the entire canal. Only here and there there'll be gaps, right? That gap is taken by your bone cement. This type of cementing technique or this type of broaching or this type of stem design is based on principle of French paradox. Okay, this type of technique is called as French paradox. This is the latest technique and they say it has got least failure rates, okay, comparing to the others. So we know about how the cement affects, how the broaching affects. Now we'll discuss about other aspects of failure. What are the different things? Before moving on to it, just a single slide on this. What are the modern cementing techniques we know? We know pulsatile lavage. We know cement restrictors. We know using a retrograde, that is using cement gun. Okay, and pressurization. Pulsatile lavage is done to dry the bone. Okay, to get better interlock between the your cement and the cancellous bone. Distal cement restrictor is used. Why? For example, this is your canal and you have put a cement restrictor so that the cement will stop here and whatever extra cement will be there, it goes into the cancellous bone. Okay, it goes into the cancellous bone. So what does the cement restrictor acts like? It helps in pressurization of the cement. Okay, and retrograde application to prevent the air pockets. Okay, and cement gun. This is other technique. Along with this, vacuum preparation. Okay, this is a modern cementing technique. Okay, but this also has an implication in early failure. If this is not done properly, it has got an early implication of failure. Next, coming on to the surface roughness. Okay, how surface roughness will affect your cementing? What surface roughness will do? We know again. Let us start again. There's a bone, there's a cement, there's a stem. Okay, if this bond you want, okay, and you want this bond, let me call this is S, this is C, bone cement, this is bone. Okay, green, if I want green to be strong, that is bone and cement should be strong. Relatively, green is stronger than purple. That means what? I should have a loose bond between the cement and the stem. When will I have that bond loose? That time the stem must be polished enough. It should be polished enough, so that the strong between bone and the cement will be high. If I keep this stem surface rough, then rougher than the bone, then it reverses. Okay, this bond becomes more. If the bond between the cement and the stem is more, that is composite beam, that means the stem surface must be rough. If the bond between the bone and the cement must be strong, that means the cement and the surface stem should be loose. That will be in case of polished. Okay, that should be polished. So that is how Charlie devised all these methods, how the stem is placed. So the original Charlie stem was polished with average of only 1 millimeter roughness. But Charlie's stem is based on what principle? It is based on composite principle. So we need much bonding, more bonding. So between the stem and the cement. So what they did, they increased the roughness up to 0.75 millimeter or higher. What did it give? It gives improvement in the interlock between the stem and the implant or the processes. But in taper slip concept, what we need? We need less bonding. So what the Exeter group stem had a roughness about 1 millimeter with a matte surface. They were using certain material for the preparation of the stem, but after using a 316L, the stem become more matte finished. Okay, so that matte finished stem started to have higher aseptic loosening incidence, and it went up to 20%. So they came with again polished taper stems without any matte finish. They came with just polished taper stems. This is very important. Roughness also decides what type of cementing concept and philosophy you're going to apply. Okay. So next, coming on to the stem metal. What is the best stem metal? Sir, titanium use करना है, cobalt chrome use करना है, कौन सा use करना है? Okay. The ideal stem should be, because it is going to be there for lifelong of the patient, it should be corrosion resistance. Okay. It should have adequate material, and it should be inexpensive for the manufacturers to be made in large quantities. So that's why alloys of cobalt, chrome, iron, titanium all came into metals. I mean, came into oak. Out of this, titanium modulus of elasticity. Modulus of elasticity means the strength or the ductility of the material is almost approximating that of the bone and the cement. Okay, the modulus of elasticity, the Young's modulus of elasticity of bone and cement is almost equivalent to that of the titanium. So that's why the titanium were very attractive. But how many of us we start using titanium? Have you seen titanium stems? No, right? So anyone use titanium stems? No, all of you use cobalt chrome alloy stems because titanium has got one bad property of cervix corrosion. It has got a property of corrosion. This corrosion will lead to failure. So that is the reason titanium stems are not preferred. It is the cobalt chromium stems are preferred. Okay, cobalt chromium alloy or stainless steel stems are preferred. Because of this nature, they have stopped producing titanium prostheses. Okay, you should always go for COCR alloy. What is called as COCR alloy? Cobalt chromium alloy. Don't go for titanium stems. Okay, older generation stock clearance, they give you titanium implants for lesser cost. But disadvantage is it has got a cervix corrosion. Especially if you're doing a cemented implant, don't go for titanium implant. Okay.